Still Standing is sponsored by Fairfax Radiology.
The experts at Fairfax Radiology want to stress the importance of routine mammograms and dispel any misinformation about screenings. Kristen recently spoke to Marana Coluccio, who is the manager of Fairfax Radiology Breast Center of Loudoun.
Marana, a lot of people are apprehensive about getting their first mammogram. So what do you say to somebody that's, even if they say everything feels normal, everything's normal, why is it important to still get that mammogram?
Right. So our goal is to find something on a mammogram as early as possible before you can feel it and before it's showing any signs or symptoms. And finding something early is key to recovery. So we recommend that everybody, regardless of symptoms, start a screening mammogram at the age of 40.
Okay, age of 40. Who else should be getting a mammogram? Even like if you maybe don't have a history or don't really know, who should be getting this mammogram?
So the lifetime risk for an average woman is 1 in 8 women will be diagnosed with breast cancer. If someone has a strong family history, they might want to start their screening mammograms even before the age of 40. Strong family history would include a first-degree relative like a mom or a sister. But generally, for the general population, women should start at age 40.
Okay, you say 1 in 8 women will get breast cancer, but men also get breast cancer. What do we know about that demographic?
So yes, men do get breast cancer, and about 1% of breast cancer diagnoses are male breast cancers, and we do see men at Fairfax Radiology for mammograms. However, there is no general recommendation that a man should get an annual mammogram. Now, if there is a symptom, and the symptoms would be typical of the symptoms that a woman would experience, a lump or thickening, maybe change in breast size or shape, changes to the skin like dimpling, then we definitely suggest coming in and getting a mammogram.
Okay, good thing to know for everybody to know what some of the symptoms are. Does it matter where you get your mammogram?
Absolutely. Here at Fairfax Radiology, all of our doctors are specially trained and read only mammograms. These are people who are dedicated to breast imaging alone. They're not reading other body parts like generalists do. And that means that they are trained, their eye is trained to detect something probably earlier than other places would detect them. So Fairfax Radiology is the best place to be.
All right, we've also heard the term dense breast. So how does a woman know if she has dense breast? And then what type of mammogram does a woman that has dense breast, what type of mammogram should she get?
So dense breast tissue means that you don't have a lot of fat in the breast. And the reason that's important is because fat on a mammogram is gray and a breast cancer on a mammogram is bright. So you get that great contrast with the gray background in fatty breast tissue. If you don't have fatty breast tissue, if your breasts are dense, it makes the cancers a little harder to detect. And therefore, we suggest doing a 3D mammogram called tomosynthesis, which we offer here at Fairfax Radiology. And the way to know if you have dense breast tissue is that it will be stated on your mammogram reports. That's really the only way to know, is to have a mammogram, and we will tell you if you do have dense breast tissue or not.
Okay, so physically you wouldn't be able to tell through the mammogram and through the imaging that way.
Correct.
I did not know that. Okay, good to know. What about a woman that has implants? How does that mammogram work for her?
So a woman who has breast implants should still be getting an annual mammogram, and our technologists at Fairfax Radiology are specially trained to do mammograms on women with breast implants, and we do them every day.
Okay, good to know. Such great information, Marana, and so important to remind everybody how important getting these screenings are, especially with a specially trained eye. Thank you so much for being here.
Thank you.
For more information and to schedule a mammogram, visit fairfaxradiology.com.